Sinus tachycardia. Sinus tachy. So impulse at a fast rate than the normal result in sinus tachycardia greater than 100 beats per minute but less than 120. And again, it is called sinus tachycardia because the rhythm is originating from the SA node. Here's the SA node, and it is the rhythm is coming from there, or the impulse is originating from the sinus node because it is because that's where it comes from, the pacemaker, and so it's called sinus. It is fast, but it's called sinus because the beat or the rhythm originates from the sinus node. So what are some of the causes of tachycardia? Acute blood loss. We spoke about that early on, saying that one of the first initial compensation that will occur is that the heart rate will increase. So you see tachycardia in acute blood loss. Anemia. Who can tell me why is it that you'll see tachycardia in anemia? Red blood cells have 4 molecules of iron on it, and on each molecule of iron they carry 2 oxygen. So if a person is lacking in iron, then they will not have the ability to carry oxygen, and so the body kind of sense that and beat faster, increase heart rate to compensate for the decreased level of oxygen. Shock. Shock is another thing. Poor perfusion, and shock can be caused by anything. What are some of the shock that exist? Cardiogenic, hypovolemic, anaphylactic, septic. There's another one. Neurogenic shock. Yes. And so heart failure can cause tachycardia. Hypermetabolic state, such as in even someone having hyperthyroidism, increases the heart rate. Fever can increase the heart rate. Exercise, of course, increase the heart rate to compensate to taking more oxygen. Medications such as catecholamines. What are catecholamines? These are like epinephrine and the norepinephrine. And if you know the action of epinephrine and norepinephrine, they actually work in the fight or flight response. So during fight or flight, blood pressure is increased, heart rate is increased. Also the theophylline, atropine, caffeine, nicotine, amphetamines, cocaine, ecstasy, and all of these increases the heart rate. Excessive sympathetic tone, and we're talking about sympathetic tone, we're talking about the same fight or flight, someone getting ready to fight or someone getting ready to run, there's going to be an increase in heart rate. Stress, psychological, someone being anxious, someone having pain can also increase the person's heart rate. So knowing all of these, both the physiological, the medication, and the psychological factors that can increase the heart rate, then you should use this information to drive what your treatment is going to be. Because if it's acute blood loss, you want to stop the bleeding and you want to administer medication. If it's anemia, then you'd want to correct the problem by giving some form of iron and giving some kind of oxygen. Depending what causes the shock, then you want to correct it. If it's because it could be because of an MI, it could be because of some form of obstruction, but you want to give oxygen and also give fluid and prep the person, the client, to get ready to go to the cath lab or something. Thyroid that's causing it. If it is a fever that's causing it, then you'd want to give medication to bring down the fever. So that's why questions are not necessarily a cookie cutter. A lot of students will see, oh, the person, they give it a scenario. Patient came from surgery, heart rate, for example, abdominal surgery, heart rate is 110, 120, whichever follow would the nurse do. And so one of the first initiative a student would jump to is pace the patient. The fact that they had abdominal surgery, most likely they're in pain, give some pain medication. So it all depends on what causes the tachycardia. That's how you're going to treat the person, especially if they're symptomatic. Symptoms that you'll see for tachycardia is syncope, hypotension. If it persists, it may cause also acute pulmonary edema and also posterior orthostatic tachycardia syndrome. So what that is that when one changes position, then they have tachycardia because the body is compensating. Because remember, changing position can drop the blood pressure, so the heart compensate, and so they have tachycardia because of that. So what is the treatment? If asymptomatic, no treatment is needed, because you have some people, their heart rate is just 110 and that's it, and they don't have any symptoms. But if it is symptomatic, then they may want to treat it with beta blockers such as Lopressor, metoprolol, atenolol. They may also want to give calcium channel blocker also to treat the tachycardia. So there is something that they call catheter ablation. Okay, so what they do is in the catheter ablation, they actually destroy specific cell that causes central conduction. So if it's a cell that is in this area that is causing the tachycardia, they actually go inside and destroy the cell that are beating abnormally. The treatment of posterior orthostatic tachycardia syndrome include increasing the fluid and also including sodium. So that's one of the things that they'll do to treat sinus tachycardia. But if there is no symptom, if the person is asymptomatic, then no treatment is needed. Okay, and remember, why is it called sinus tachycardia? Because the impulse is initiated from the SA node.